All right. Good morning, everyone. Thank you for joining us today. We're excited to have you here and talk about Central Health's new overdose prevention program. We have three presenters joining us today. First up, we have Lanaya Smith. Lanaya is a healthcare operations coordinator for mental health and addiction care at Central Health. In her role, she supports strategic initiatives that expand access to care and advance overdose prevention efforts. She brings together operational expertise, cross-sector collaboration, and program coordination to strengthen community partnerships and improve health outcomes across the communities Central Health serves. Additionally, we have Amber Hillenbrand.
You guys are upset.
Amber is the Associate Director of Operations for Mental Health and Addiction Care at Central Health. A licensed chemical dependency counselor, she has dedicated her career to serving individuals with mental health and substance use treatment needs, particularly those involved in the justice system. Amber is passionate about building partnerships and expanding access to evidence-based treatment. And finally, we have a guest presenter, Emily Gray from the NICE Project. Emily is the founder of the NICE Project, which stands for Naloxone in Case of Emergency. NICE expands access to Narcan and other harm reduction supplies by installing free, no-barrier vending machines and providing weekly outreach in high-need communities. In addition, Emily is a 2024 graduate of Central Health's Community Health Champions Program. All right, thank you all for being here, and with that, I will turn it over to Lanaya.
Good afternoon. My name is Lanaya Smith, and I'm the Operations Coordinator for Mental Health and Addiction Care at Central Health. And today I will be talking about our Overdose Prevention Program. But before I get started, I would like to ask if there's anyone on the call who is familiar with naloxone. Drop your responses in the chat. If not, that's okay. We're here to learn. In 2024, Austin experienced an outbreak of opioid overdoses, which tragically resulted in 8 deaths and over 50 emergency calls within a 27-hour period. To the right is a map from areas in which those calls were received. We actually pointed out one of our administrative offices at Central Health. This map highlights overdose deaths in Travis County. If you take a look at the map, you can see a little bit of the red and yellow areas in Central, East, and South Austin. Currently, our naloxone units in these areas have high usage. From this data, Central Health recognized that we did not have an established approach for distributing naloxone to our community members, especially our patients. We also recognize the stigma that is often attached to naloxone, which discourages people from seeking help and carrying. We made it our mission to make this resource available to everyone with no questions asked. To help move this work forward and reduce stigma, we began providing education and training to our clinics and community partners, and we have some of those pictures here. Here is one of the videos that we typically go over during our overdose prevention education training, and it tells you how to administer naloxone.
Every 5 minutes, at least one person in the US will die from an opioid overdose. But overdose can be reversed. Naloxone is a medication that temporarily reverses opioid overdose. Opioids are drugs that alter the body's perception of pain and can cause sedation and euphoria. Fentanyl is a very strong opioid. Sometimes fentanyl is found in other drugs. When someone takes too much of an opioid, they become unconscious and their breathing begins to shut down. If an opioid overdose is not reversed, it's likely that this person will stop breathing and die. That's why it's important to give naloxone quickly. Naloxone is safe to use even if you don't know what someone has taken or why you can't wake them up. You may notice cool, clammy skin, blue or gray lips and fingertips, and snoring or gurgling sounds. If you think someone may have overdosed, try to wake them up. Ask, "Hey, are you okay? Can I try to help you?" Try to shake them awake. If they don't wake up, check their breathing. If they're breathing less than once every 5 seconds, if you see their chest or belly moving only a little, or if they're not breathing at all, explain loudly and clearly that you're going to give them naloxone. If someone else is there with you, they can call 911. If you can, roll them on their back. Peel back the foil on the package and remove the nasal spray. Hold it with 2 fingers on either side of the nozzle, but be careful not to press the plunger yet. Gently insert the nozzle into their nostril and press the plunger all the way in until it clicks. This releases the entire dose. To prevent choking, roll them onto their side with their knee and their elbow out in front of them. If you're alone with the person who's overdosed, now you can call 911. Remember that someone who has overdosed may be breathing slowly or shallowly. If they're breathing less than once every 5 seconds, or you see their chest or belly moving only a little, rescue breathing is essential. First, make sure nothing is in their mouth. Then, roll them onto their back. Place a rescue breathing barrier mask if you have one. Tilt their head back and lift their chin. This opens the airway to allow your breaths to go in. Pinch their nose closed and give one breath slowly, watching to see their chest rise. Continue giving one breath every 5 seconds, and be careful not to give breaths too forcefully or too frequently. If you hear gurgling sounds or they start to breathe deeply on their own, stop and roll them onto their side. Naloxone takes 2 to 3 minutes to work, so it's important to wait before giving more. If they're not breathing effectively after 3 minutes, it's time to give another dose. This time, you'll use the other nostril in case the first one was blocked, but everything else is the same. Peel back the foil, put it in place, and press the plunger. Then resume rescue breathing until the person begins breathing effectively on their own. Remember, this means they are breathing deeply and at least once every 5 seconds. Most overdoses can be reversed with just 1 or 2 doses of naloxone, but if there's no response, keep giving rescue breaths and make sure to wait 3 minutes between any additional doses. Once they're breathing effectively, the overdose is reversed. When people wake up after an overdose, they may not know what's going on. Take a step back and explain. I couldn't wake you up and you weren't breathing enough to stay alive. I think you overdosed, so I gave you naloxone. I'm here to help, and I'll stay here with you to make sure you're okay. If this is someone who uses opioids regularly, they may be in severe opioid withdrawal and in extreme pain. They may want to use again. Let them know that they'll feel better when the naloxone wears off. If they refuse medical care, try to have someone they trust stay with them for the next several hours or overnight. Try to make sure that person has more naloxone and knows how to use it. Carrying naloxone with you and being ready to give it is easy. You just learned how in less than 5 minutes. But we still have so much work to do to end this public health crisis. So thank you for taking the time to learn how to use naloxone. Thank you for carrying it with you. Thank you for being ready to extend life when someone really needs your help.
Along with providing education, we decided to increase our naloxone access points. We currently have 31 units throughout Travis County. I would like to highlight our unit in the middle, which is our vending machine. This machine is available 24/7 at Community Care, Care Connections, and the Clinical Education Center. This data shows that overdose prevention efforts from Central Health, Community Care, and our community partners is making a difference. I would like to highlight the decrease in numbers from 2023 to 2025. What's next? We are currently recruiting employees at Central Health and Community Care to be overdose prevention champions. These individuals will serve as the point of contact at their clinic site for overdose prevention and awareness. While restocking the units at a couple of our clinics, I often came in contact with patients who had questions about naloxone, many of them thinking that it was allergy medication, which is how we identified the need. The program is expected to go live in October of 2026. I would like to thank our community partners for their contributions to our success. Pictured here is Daniel Sledge, who works with the UT Farm program and provides a lot of our overdose prevention education. Now, I would like to turn it over to M. Gray, who can tell you more about the NICE project.
Hi there, my name's Em, and I'm with the NICE Project. The NICE Project is a low barrier grassroots initiative supplying naloxone and direct community aid in Austin. What started as a vending machine project has extended into a vital outreach program providing those who use drugs with non judgmental access to overdose prevention and safer use supplies. We maintain 4 Narcan vending machines around the city and table directly to our patrons 4 times a week. The organization has received grants and sponsorships from Comer Foundation, the Drug Policy Alliance, Remedy Alliance, and many more. We have been recognized in the Chronicle Best of, we've been recognized as community health champions, and we've been recognized as leaders of naloxone access in the city. We are an all volunteer outfit with lived experience, allowing us to break barriers and build trust in our efforts. As an organization founded on the tenets of harm reduction, we believe that drug use is a multifaceted issue that can only be tackled by focusing on an individual's well being through non coercive support and anonymity. We believe in uplifting the voices of those in need and empowering users to be primary agents in the reduction of harm. In an effort to destigmatize addiction, we recognize the social inequalities that are linked to vulnerability and drug use, and we do not minimize these harms. We believe that the voices of those who use deserve to be heard, and that direct community aid provides a necessary bridge to other state funded social programs and access to healthcare. In an effort to prevent overdose, naloxone is an incredible tool that we have at our disposal, and we believe that there should be access and education for all. Nasal naloxone has broken barriers, but injectable naloxone can still be stigmatized. We believe that access to support, such as clothes, food, water, wound care, hygiene, and other essentials, is vital in the life outcomes of people who use substances and the prevention of overdose while allowing for dignity. Access to safer use supplies also reduces the need of diseases, the spread of diseases, and keeps our communities safer. Test strips are also vital to this effort, but unfortunately, their illegality is harmful to our operations and creates barriers to our patrons. Unfortunately, harm reduction organizations like the NICE Project struggle with many roadblocks to care. In general, federal and state organizations prefer abstinence only programming. Vulnerable populations who use our services are often targeted by APD scare tactics and raids. There's boundaries in education regarding who harm reduction is for and how people can participate in prevention. But the greatest hurdle for harm reduction organizations like ours is in funding. With increased limitations on federal and state resources aimed at social services and community care, harm reduction and grassroots activism take the greatest hit. We also find that resource expectations are generally out of balance with smaller organizations being used for insight, education, and connection with little reciprocity when it comes to bureaucratic insight, funding, and supply support. There's a disconnect between grassroots and established larger nonprofits. And because we are a volunteer led organization, we are allotted little time to research funding, write grants, and argue for policy change. We seek better resources and connections with larger nonprofits and hope that the future of support keeps smaller organizations like the NICE Project in greater conversation. Narcan is an important step in reversal, but overdose prevention needs to be a much larger conversation rooted in destigmatized community care and non judgmental access to those in need. Grassroots efforts should be supported by larger nonprofits who understand the greater bureaucratic boundaries and have access to significant funding initiatives. The aim is always to educate people on addiction, provide the resources to those in need, and support one another in the fight against stigmatized drug use. But in a state already in a funding deficit, it is up to us to rewrite how we support one another for the greater good of our communities. So how can you support the NICE Project and harm reduction? Educate yourself on overdose prevention. Know the signs of overdose and carry naloxone, of course. But you can also support our outreach efforts by donating time, money, and supplies. You can attend our events around the city, from kit making pop-ups to film screenings. You can also partner with us, as we are always looking for opportunities to do trainings and host events. And of course, you're always welcome to come out and see what we do. Please click the link or go to the QR code if you want to learn more about volunteering with us. And that's all I got. I appreciate your time. Thank you.
Thank you, Em. If you're interested in getting involved, here are some ways that you can help. For additional information about naloxone in your area, Please view the naloxone vending machine location map located on the Texas Health Data website.
All right, thank you, everyone. And now we can open it up for questions. If you'd like to drop questions in the chat, our presenters can view them, or if you would like to unmute, you should be able to speak directly to our presenters. So we'll open it up now.
Oh, one of the questions that came up was how to volunteer with the NICE project. Do you mind going back over that again?
Sure. So we have many different opportunities for volunteering. One is to pack kits. Each dose of naloxone comes in a little bag like this. We just do it one dose at a time because that's how our vending machines work. They only distribute one at a time. So the side note, with that, we've distributed over 10,000 doses of naloxone in the last 4 years. Volunteering for us looks like packing these kits, which are necessary for the work that we do, but we also do street outreach, where we go out into the community and provide people who use drugs with the things that they need. So to volunteer, you basically just need to fill out our volunteer form. We learn a little bit about you and your experience and what you're most interested in, and then you can come out with us on outreach. And it's usually about 1 or 2 hour shifts, and we just get people what they need, and that's what volunteering looks like for us.
I know with volunteering, it is such a powerful thing. And I'd love, if you could talk a little bit about why that street outreach component is so vital to caring for our individuals who may need this life saving medication. At Central Health, of course, we have our naloxone vending units inside our buildings and then some on the street. But really bringing it to the people has just an extra layer of care and compassion for our community. So, do you mind talking a bit about why that matters?
Sure. So we believe that Narcan is a great tool, and we love that it's available through vending machines throughout the city and other avenues in Austin. However, harm reduction is so much more than naloxone. Things like housing, basic needs, safer use supplies, all of these things will help with quality of life, but also reducing overdose deaths. We Sorry, I lost it.
And at Central Health, I know we absolutely, support the work. It's been such a pleasure to be able to partner with the NICE project and just be able to work collaboratively because we know it really does take a village to serve our community. Um, Lanaya, do you mind talking a bit more about the Overdose Prevention Champions and how having the different team members at the community care and Central Health sites makes that extra layer of impact when they're educated and trained on naloxone?
Sure. Well, again, the Overdose Prevention Champion is a new initiative that we are expecting to go live with in October. And so I feel like it was important to have these individuals just for like basic questions. You never know who you come in contact with at the clinics who have questions about naloxone. And I kept getting the concern that a lot of people would think that it was allergy medication. So having these individuals in the clinic would be extremely important. And plus, it promotes collaboration across central health and community care.
Thank you. It looks like we do have a question in the chat about how do you have, or do you all have some pointers on how to convince people that the availability of this life-saving treatment is not encouraging people to be addicts? And I'll open that up to you, Em, first, and I'm happy to repeat the question if needed.
So people who use drugs are smart. They will often know that naloxone exists, and they'll often carry it for each other. I think that our greatest barrier to education is training the general public that does not use drugs. I think there's a lot of stigma there, and I think understanding that the access to naloxone does not promote use. I've heard in the past about Narcan parties or something like that, but it doesn't promote drug use. It just helps keep people safer and alive, which is our biggest goal. Um, I think that people who use drugs will often use test strips. They'll often use Narcan. They'll often, even without those things, know how to do rescue breathing and know how to keep each other alive. And I think that we are set up for success in that way. I think that training people to use Narcan if they stumble across somebody is great. But I do want to reiterate that other things like housing and healthcare are the main things that we strive for.
And I'd like to speak to that as well. I think Emmy made wonderful points there. I do think it is a challenge. So being able to convince people that availability of this life-saving treatment is not encouraging people. I think the main way to do is really education and outreach. So helping people to understand what the purpose of this medication is. This is a treatment that saves lives. There's been a lot of work, I think, that's been done on educating people about other types of medication-assisted treatment or substance use treatment, and following in that vein is very helpful, but really, I think having activities such as this, where you're doing lunch and learns and talking to the people who are really key members of our community, people who are having those relationships, who are embedded in our community, and that's where the real change happens. So it does make me think of the NICE project and really having that grassroots approach, because although there is higher systems level and advocating to our policymakers, being able to just be frontline there with your people, like you all are as community health champions, and being able to bring awareness to this medication and what it does, how it works, and normalizing it. Those are really what make a huge change. I also want to just touch on, and perhaps or Lanai, if you'd like to speak to this as well, thinking about the language that we use when we're talking about people who are struggling with substance use, addictions, or alcohol use. Because I do think, and the question was phrased perfectly because I saw the, quotes, the addicts. That's very different to have someone be referred to as an addict than to someone who has a substance use disorder. My personal belief is that I think when you refer to somebody in that way, what it does is that is how they are defined. And that also encourages how they see themselves. And I'll just speak for my personal experience, having family members and friends who've struggled with substance use over the years, when they have people who just recognize them and encourage them as you're actually a mom who's struggling with substance use versus you're an addict, being identified as who they are and what is really valuable, that makes a huge change. So I do think words matter as well, and using your language, being mindful of that, is what will also help destigmatize the use of naloxone. So, Em, if you don't mind, I'd love to hear about your thoughts on how words matter and how we refer to people and who have struggles with substance use. What are some things that our community can do to help change that in the way that they phrase things and the way that they say things? And then, Lanai, if you have thoughts on that as well.
One quick thing I wanted to say about the last question about stigma and getting people what they need without presuming that they're going to be more liable to use. I think that it's really important that grassroots organizations with people with lived experience are a part of the implementation of these programs. I think that to build trust with people who use drugs requires consistent care, loving care, non judgmental care. And I think that that's where we get into the destigmatized language as well. So I think that it's important to use person first language, where we say that it's a person who used drugs. I think it's important to say, instead of calling somebody in substance use disorder, to presume that somebody is having a substance use disorder. I think it's important to recognize that people use drugs for all kinds of reasons, and they don't necessarily have a substance use disorder. I do think it's also important not to correct people and how they identify themselves. There's a lot of stigma even within the drug using community of different substances for different folks. And I think that you can gently educate them without necessarily outright correcting them and turning them off to the services that we provide.
Thank you so much. And I see we have many more questions and comments that are in the chat here as well. So do want to address those. Alice, I see you identified anonymous pickup. That does make a huge difference. Being able to have this medication available and have it available 24/7 where they don't have to go in and register to get something or see a provider. It's just literally walking up, whether inside the building where we have those locations, or of course with the NICE project, especially there's so many different locations external, people can just have that quick access. And I love Guy Paul. He said, so it sounds like turning it around to remind people that the focus should be on saving a life. That is exactly what it is, because that is what this medication does. So let's go over to the chat here. A couple more questions that we have. So Alana asks if regarding naloxone administration, if naloxone is used on someone who is unresponsive for a reason other than opioids, is there any risk of harm to them? Turn it over. Would one of you like to address that?
No, there isn't any harm to that. So I think it's always better to be safe than sorry. Would you like to add anything?
One of the other questions, and it's funny, I see the question is naloxone okay to leave in your car, even in Texas heat? We were actually just talking about that as it is a nice, sweaty Texas day outside, and thinking about the naloxone itself does have some temperature information listed on here. However, I know NICE Project has actually done a lot of research on this, and one of the things that you all found is that naloxone can be used even if it is not kept at, I forget whatever that exact temperature is here. Do you mind just touching on that? How naloxone in the temperatures?
Yeah. So naloxone is a very stable molecule. It can withstand really hot, hot, really cold, cold, and really quick changes in between the two. It is super strong. The box says a lot of things, which are limited by the testing that they did, and not necessarily by real life applications. Um, the expiration date is also something that they only tested it for so many years, sure, but there's also been academic studies where they've tested it up to 30 years past the expiration date, and that molecule is so strong that it doesn't break down within that time. So, yes, the box has some information on it. The temperature thing, I think that for grassroots organizations like mine, um, refrigerating Narcan vending machines is a huge barrier cost wise. I think that, we've been distributing this medication for 4 years in non refrigerated vending machines, and it's saved many, many lives. So I think that acknowledging that the box has some instructions on it, but also knowing that in practice, those aren't stringent and hard and fast rules.
Thank you so much. That's, yeah, I think that just speaks to, just being able to have access. And it is always better if you would have that and you would see somebody who may be in need, give them the medication. Truly do. Don't worry. Oh no, was it temperature controlled for this period of time? Oh, did we have? Give it to them, because we always want to be able to do everything we can to save a life if we think there's somebody who may be experiencing an opioid overdose. So back in the chat, I see Mackenzie had asked or had mentioned that naloxone helps reverse opioid overdose. However, other types of overdoses like meth, are there any types of medication for that? So for acute reversal of meth, there is not a medication. I will say there are some different medication assisted treatments that I will actually, I'll just give a plug right here. So we have a WAM clinic at Community Care, which does provide medication assisted treatments to individuals. So again, there are folks who are able to provide services if an individual is experiencing detox. We do have some community partners who we work with that, but I definitely would recommend checking into that more. It's an ever-growing field, and we're learning new things every day. So that was a great question. That's
One quick thing about that is, yes, other drugs have overdose effects, and you certainly don't. There's ways to prevent against that. Sure, one of them is to not mix drugs. Not mixing drugs can, sometimes they can amplify the effects of each other. Never using alone, making sure that if you use, no matter what substance, you want to make sure that somebody has your back. There are overdose prevention hotlines such as Safe Spot and Never Use Alone, where you can call somebody when you're thinking about using drugs. And if you become non responsive, they can reach out to help and get somebody to come check on you and reverse an overdose, hopefully. Um, so, yes, be cautious with other drugs as well.
that was awesome. Thank you so much. All right. Let's check in the chat. See, thank you all so much for asking these wonderful questions. And I do want to emphasize too with naloxone, one of the things I've heard it referred to is, think about this like a first aid kit. So when you're thinking about having naloxone, this is not just for individuals who are using substances. I carry this with me. It's in my backpack. I keep one in my car, and my husband does the same. This is something for you all to have. So truly, if you are nearby one of the locations, either Nice Clinic or Central Health, please pick this up. You can also get this from CVS. It is not a prescription drug by any means, and just have it with you because you truly could be the hero who saves the life of someone. And again, as we've talked about, this is an incredibly safe medication. So if you're not sure, but you see somebody unresponsive, you don't know, maybe is it they're having a diabetes reaction, maybe it's an over, you're not sure what's going on, you err on the side of caution. As you saw in the video, there's different steps you can take leading up to it, but please have this medicine with you because it truly does save lives. All right. So, Guy Paul, I see you also put in the chat about the do organizations that distribute naloxone in vending machines that do not protect them from extreme temperatures. Are they vulnerable to legal action if the medication doesn't work? So actually, I don't, I think that may be a question for you, and I can reread it if you want. I know I said.
As far as I'm aware, there is no legal action. I think that that action would have to be brought upon somebody who maybe didn't have their overdose reversed effectively, but time and time again, we do have these overdoses reversed effectively. I don't think that I've ever heard a complaint besides somebody speculating on the temperatures. Um, and we, our grassroots organization, I think it would be, very difficult if legal action came upon us, but I'm not particularly worried about it.
Thank you. And also do want to just call out in the chat. I see Jen, you added a website there for neverusealone.com. So thank you for sharing that resource. And speaking of resources, uh, would like to turn it over Em or Lanaya. Are there any particular other resources, websites, or places that you think people could become familiar with to continue to learn about any sort of overdose prevention or safe use practices or any of those type of things that can just help our community health champions to be more aware of how to support people who may be experiencing substance use? And again, I will give a plug for Community Care, our WAM clinic, which does have medication assisted treatment and a host of other services that are really here to support individuals. So all are welcome. And we never deny services to anybody based on ability to pay. Of course, there's MAP. WAM Clinic does accept different insurances as well. So that was my plug.
Definitely the WAM Clinic and also THRA, which is Texas Harm Reduction Alliance. I know on my slide I had a couple of resources on there, and I can't remember them off the top of my head, but I'm looking through the chat, and there's plenty of resources here. Do we have a QR code for some of the resources? Um, if not, I'm going to drop the links in here.
So I think that being community based and mutual aid oriented, I think that organizing and finding your people is going to be the most effective key to saving lives. I think it takes a whole village, and there are support groups for people who use drugs that are non-judgmental. They're called harm reduction works, and they're mostly virtual. But they also have side projects for sex workers. They have side projects for people that want to stick with people that use their own substance. So I think it's a really cool resource. There's also drug user unions. Drug user unions are a collaborative effort that fight for policy change, support each other, do really cool work. So I would look out for a drug user union near you. Um, they are often called drug user unions or um, harm reduction alliances, or I'm forgetting what else they're called. But they're great resources.
And I definitely encourage everybody else, seeing some great discussion and information in the chat. So please do, if there's resources that you all know of in the community, drop those in the chat right now. Want to give highlight to all the wonderful work. And we know, again, it takes a village to be able to support one another. So we always want to be sharing resources, making sure everyone is aware. And I also do want to just call out too, thank you so much, Daniel, for citing that the verbiage in the Texas Senate Bill 1462 does release individuals and entities from liability, criminal or civil, regarding naloxone distribution. So we got a bunch of experts here. This is excellent. Oh, and Jen, thank you for highlighting too that Integral Care also has a MAP program and narcotic treatment program, which does both methadone and buprenorphine. So keep sharing those resources. Again, the more we can get the word out about what is there and how to help each other, it just makes things better. And we just really, truly appreciate your time. So any other questions or comments? Otherwise, I have one last question for Em and Lanaya. All right, Em, I'll start with you. I feel like I'm just tackling you with all the questions. But if there is one or two things that you can think of that you really want people to take away from this presentation, I'd love to hear that. I know for me, some of the, a couple of the top takeaways we want people to know is what you do matters. You all are the keys to helping our community be healthy. And so want you to take this information and please share it. Also, too, just again, recognize that naloxone is easily available and it can save a life. So please carry naloxone with you. This, it's again, easy to get. You can feel free. We have it all over the place. You have our contact information as part of this presentation. So please reach out. We're happy to make sure that you all get connected with that. So either Em or Lanaya, if you don't mind sharing one or two takeaways, that would be great. We'll start with Lanaya.
Yes, my key takeaway would be again to carry naloxone, and if possible, make sure that you have it on you. If you ever were to run it, if you ever were to run into an emergency, it would be extremely helpful to have it on you as opposed to somewhere in your car. So yeah, please carry naloxone.
I remembered that the other name for drug user unions are called survivor unions. So there's that. Um, I also want to highlight that harm reduction is more than naloxone, and that greater policy change and access to treatment, access to housing are going to be just as important as everything else. I also want to highlight that people who use drugs are smart, they're capable, they're resilient, they take care of each other, and they're not so different from you. And I think that's important to recognize in a way of reducing stigma, but also trusting people with their own lived experience and what they need.
Very well said. And it does go back to also the words you say. It really does matter because you also never know what somebody is going through and what someone's struggle is. So the way that you talk about one another and the way that you talk about individuals who may be experiencing a substance use treatment need or just even having some struggles, be kind, be compassionate, because you never know what you're going to say or do could either help or harm someone. So always try to have the most just compassionate, caring approach that you possibly can. So, all right. I think with that, if there's nothing more, then thank you so much for all this.
Yes. So thank you, everybody, for joining us today. Thank you to our presenters, Amber, Lanaya, and Emily. If you have any questions that you couldn't think of in the moment or something comes up later, please feel free to email me at christian.nelson@centralhealth.net. I dropped that in the chat. Yesenia just put it back in there again. So with that, we'll let everybody go. We have a recording that will be up on our YouTube channel, so we'll get that sent out to everybody as soon as that is up. Feel free to share with everyone you know that might be interested, and we look forward to seeing you next time. Thank you, everyone.